This is WCNY's The Capitol Press Room, and we're joined remotely by Dr. Chinazo Cunningham, the Big Ten batting champion of 1990, who is now the commissioner for the State Office of Addiction Services and Supports, and is here to discuss what the governor's budget means for her agency and its mission. Welcome back to the show, Commissioner.
Great. Happy to be here, David.
Well, I want to start with capacity. Given the constant growing demands on your office, what sort of staffing levels does the governor's budget support relative to, say, the current fiscal year staffing levels?
Yeah, our staffing level is about the same as it was last year. Last year we had quite an increase in the number of staff. So, we are in a good position to be able to really address our full continuum of services. So that includes prevention, treatment, harm reduction, and recovery. And, I think that this budget also includes additional dollars for some of the big policy changes that we've seen in the last several years that really include cannabis legalization and gambling, online sports betting legalization.
Well, it's one thing to get, say, lines for hiring people in the budget. It's another thing to get a chance to fill those positions. So you mentioned an increased support in the current year's budget. Were you able to actually fill slots in the last 10, 11 months of the fiscal year?
Yeah, absolutely. We are. And so like a great example is, we have a new gambling bureau, and that gambling bureau is totally dedicated to all of the full, prevention, treatment, recovery, workforce, et cetera, around gambling. And so that is now full. And we're able to hire, data analysts so that we can, really better analyze the data that are coming in from the operators, the, casinos and the sports gambling operators. So that is happening, has been happening. And so I think, we're going to see a lot this year in terms of the results of that.
Well, yeah, let's talk about problem gambling, both from a perspective of prevention as well as treatment and recovery. And you mentioned sports wagering, which has dramatically changed the gambling landscape in New York, far more than, say, the addition of casinos and other gambling options that have come up in New York in the last 2 decades. So how are you pivoting to meet those dramatically increased needs? And I say dramatically because the amount of handle on sports wagering is far above what I think people even projected. So what are you doing to make, say, treatment and recovery more available? And are you having any issues with meeting the needs in parts of the state?
Yeah, so this year's budget has an increase of $12 million that's really focused on addressing gambling. So that's good. And we do really think about it like we do the whole system of substance use and gambling, making sure that we have resources available to really address prevention, treatment, harm reduction, and recovery, in addition to taking a data-driven approach and supporting the workforce. So, just to give you some ideas, so with prevention, for example, all of our funded prevention providers, which is over 150 of them, do annual, education and in their communities around gambling and prevention and the potential harms. We also work with the problem gambling resource centers. There's 7 of them across the state. Their charge is to really, again, educate the public about gambling, the potential harms, and provide resources if people need them. We work with the Gaming Commission and the New York Council on Problem Gambling as well. We have a responsible play partnership, so we really all work together to make sure that the casinos are trained, that the staff, that they know that if there are issues or problems that people can exclude themselves voluntarily, and that again that there are resources available. In terms of treatment, we've really been expanding our work in getting our providers to get the kind of knowledge and training and necessary to address problem gambling. And so just in the past year, we've increased the number of treatment providers by 33% who have a gambling, what we call designation. And that designation is assigned to the public that they have gambling expertise. And so we're going to continue to expand that, but that's been a big piece of it. We also know that we are increasing the number of the our addiction counselors who are also have specialized training in gambling. That's increased by 40% in the last year, and we'll continue to build on that. We're bringing gambling into the recovery centers, also with our certified peer advocates to also have them get expertise in gambling so that they can provide that to their peers. So all of these ways to really support the services, the care, the treatment that people can receive. And then data is a big piece of this. So as you said, things are moving quickly, right? In terms of what's happening with sports betting. And so we're working with the Gaming Commission to get data from the operators so that we can really understand the patterns of use a little bit better, who's doing what, when, how, so that we can target those individuals to make sure, again, we can target them from a prevention standpoint, but we can also target them to make sure that they know that resources exist. So that we're looking forward to really getting our hands on those data and then being able to really more specifically analyze the data so that we can make sure that we're well prepared to address the needs of New Yorkers.
Well, before we move on, let me reintroduce you for listeners just joining us. This is WCNY's The Capitol Press Room, and we're speaking with Dr. Chinazo Cunningham, Commissioner for the State Office of Addiction Services and Supports. Well, sticking with the idea of data, are you finding that people are taking advantage of the additional treatment and recovery options that you have coming online, or do you have counselors and staff who are essentially just waiting for people to, connect with them?
Yeah, so we have seen an increase in the number of calls coming to our Hope line over the last several years. And then similarly, we've seen a gradual increase in the number of people who are receiving treatment related to problem gambling. So, we want to make sure that we have a system that has the capacity to address the need. This is a bit of a hidden addiction. So, like, what exactly is the need for New Yorkers? I mean, that's still a question. That's a question for the country. It's not unique to New York, but I think this is also why having better data is going to help us. And part of also what this year's budget funds is a 10-year study that's statewide to really understand the trends around people's beliefs about gambling, their use of gambling. And so that will be a more like representative sample, not just of the people who have, gambling accounts, but really all New Yorkers. And so, that's going to really help us make sure that we have a system that is well positioned to address problem gambling.
Well, unlike the work that you do in, say, the substance abuse space, you're competing with, for lack of a better word, dealers that can simply reach out to a person on their phone and say, "Hey, I got a special promotion for you. Hey, don't miss this gambling opportunity." How difficult does that make your work when trying to do sort of the prevention side of things?
Yeah. I mean, we are dealing with them, and you use the word term dealer. I mean, we have dealers in, right, illegal drug market, and we deal with that. And here we have operators, and yes, they're very sophisticated in their approaches as well. I mean, that's where the Gaming Commission and the partnership that we have with them comes into play. And the Gaming Commission is a really good partner. So they also want to make sure that the harms are decreased, right? I mean, and so we do partner with them. And one example is they've changed the regulations to make sure that we can get the data we need so that we can better understand patterns of behaviors and then, target people to make sure they know that resources exist or that we can better prevent development of problems. So it is a partnership, that we have and we continue to strengthen over time.
Well, sticking with evolving areas that you're facing, since 2021, we've had legal marijuana, and since then, we've had a recreational market that's begun to be stood up. What are some of the big challenges you're dealing with there? Is it primarily about people under 21 who are having maybe easier access to marijuana? Is it adults who are developing problems with marijuana that they didn't have in the past? What are you seeing as some of the major problems, and how are you responding to them?
Yeah, so this year's budget has an increase of a $20 million appropriation from cannabis. And so we're happy about that. Right now, it's still not clear exactly how much cash will come in from the revenues from the cannabis industry, but we do have an increased appropriation. So we'll see over the course of the year the actual dollar amount that comes in. I think what a lot of people ask us, so a lot of people are concerned about underage use for sure, right? And appropriately so. We know that young people, their brain is still developing, and we know that the earlier you use any substance, the more likely you are to become addicted to it. That's very clear. And so we're very closely monitoring, again, the data for who's doing what the behaviors are. And we actually do not see much of a change in young people and those under 18 in terms of cannabis use. That might be surprising to some people. I think also if you think about the timing of all of the dispensaries, like they're still relatively new, right, in a lot of communities. Um, and so we're monitoring this, but we do not see a big increase in the number of youth who are using cannabis. The age group that we see that really has the most use, and I would say the most problems, is actually those young adults. So that's kind of like the 18 to 25
Mm.
range. And so, that is, we're using our data to make sure that we're providing treatment, that it's evidence-based treatment. We're training our providers to be sure that they're, have that expertise to be able to do that. And then prevention efforts as well and public awareness campaigns. And so really targeting younger people, young adults, to make sure that we're reaching this population who really has the highest use compared to other age groups in New York. So we are working with Stanford University. We have a toolkit for how to talk to young people about cannabis use from parents and guardians, teachers, schools. We have public awareness campaigns. We're collaborating with the Office of Cannabis Management. We're collaborating with PTAs and school districts. We're now looking to expand in colleges, again, because of this age group and really focusing on cannabis use. We're thinking about harm reduction strategies like lock boxes, that people can take their cannabis and put it in there so that it's, keeps it safe and away from, young people and not having access to it. So there are a lot of ways in which we are really, monitoring the data and then targeting the group that's at highest risk.
Do you view the illicit market as a problem when it comes to people who might have issues with marijuana, or is this primarily through the lens of the recreational market?
Yeah, I think that's unclear still at this point. But that is something that we're closely monitoring. So, when people come in for treatment related to their cannabis use, asking detailed questions about what kinds of cannabis products they're using, where they get it from, that is part of what we're doing in terms of the data collection.
And after a quick break, we'll continue our conversation with Dr. Chinazo Cunningham, Commissioner for the State Office of Addiction Services and Supports. When we get back, we'll talk about a proposal from Governor Kathy Hochul that would create a single license for providers serving people with co-occurring disorders. And we'll also talk about money secured as a result of settlements with opioid manufacturers and distributors. And for more Capital Press Room content, visit capitalpressroom.org or wherever you download your favorite podcasts. This is WCNY's The Capitol Press Room, and we're continuing our conversation about the governor's budget proposal with Dr. Chinazo Cunningham, Commissioner for the State Office of Addiction Services and Supports. Well, turning to some more familiar ground for you and me, in order to improve the delivery of recovery and treatment options for New Yorkers with a co-occurring disorder, those can be a mental health and substance abuse condition, the governor is proposing jointly issued licenses for clinicians in order to cut down on some of the bureaucratic headaches they may currently be dealing with. How do you actually ensure that a simpler process is resulted with a singular license and not just the same amount of headaches boiled into one license?
So we're taking a tiered approach here where there's three tiers. So one tier is a single license. So that's what you were talking about. So that's not an OMH license or an OHS license. It's a single license. And that would really then have a single set of regulations, a single set of, compensation rates for insurance. And so that is happening. So we have regulations. We're hearing from the public, getting public comment, and we will probably revise some of the regulations and spend the next several months making sure that we get it as quote unquote right as possible. So, I think that the provider system definitely wants that, and we've heard them. And so this is really in response to the system. So that's at the highest level of integration. But then we also we're proposing a designation.
Hmm.
And so a designation is not necessarily one license, but it could be an OASAS, program that also has enhanced mental health treatment. And then they get a designation so that that's a sign of increased expertise, being able to have more complex patients that they're able to care for. And then the public can see that and know that that's a program really that has a higher level of expertise for people with co-occurring mental health and substance use disorders. And then the same is true for the OMH clinics, for them to have a designation showing that they have more expertise for also treating addiction. So that would be the second tier. And then the third tier would be a more basic level where, it's more of just kind of being able to address a little bit more of the basic co-occurring conditions, so not the more complex ones. And so we are in the process right now of doing that first single license and then working towards the designation as that also part of the regulations. So, I think one size doesn't fit all. As you know, it's complex. There's a lot of variability. And so we're really trying to create a system that takes that into account while also being responsive to the needs of, New Yorkers and the needs of providers. And we think that this is the sort of sweet spot is having these three tiers.
So if I'm a provider who's looking to get that singular license, who am I dealing with after the fact? Who has oversight of me? Is it OMH? Is it your agency? Is it some merged agency that we're heading toward in the future?
No, it's S combined. It's OHS and OMH combined. And
So
in
how do I know
fact,
who to
we
call?
act right. So I mean, so this is all what we're working on, and sort of figuring out in our regulations. But we'll have a shared phone line. We'll have a shared email box, right? Let me just tell you, David, this is actually not totally new. So this does exist. We do have regulations for our crisis stabilization centers, and those are, you know, open 24/7 for anybody with a mental health or a substance use or both crises. And that's also a combined single license that where OASS and OMH have worked together. So we do already have that as a model. And so this is it. So this next step is really sort of building off of that model and expanding it further.
Since you mentioned the crisis stabilization centers, we heard from a guest earlier this month who raised concerns about whether those centers are actually able to connect people to services in their community that will treat co-occurring disorders that have that co-occurring capability. Bringing it back to the idea of data, do you have any data that would back up the idea that they're making connections successfully and in a timely manner?
So let me just say that these are still new. Five are up and running. We're going to have eight by the end of this year. And, our goal is to have over 20. So this is still new. So we are close, like everything else, we are using data, we're collecting data and constantly refining and improving what we're doing. But I think it's still really early to make any sort of conclusions because a lot of these programs are literally brand new, having just opened their doors in the last either few months, 6 months, 9 months. So again, I think it's too early to really kind of make these kinds of assessments, but that is the goal. Are we going to get it right on day one? Probably not, right? I mean, it's going to take time to sort of figure this out. So it's a new model, but I would say what's happening now, people go to emergency rooms. How good are emergency rooms at, then connecting people? Probably, not that great. So this will be better, but I think it's a process. We're going to learn. We're going to constantly refine. And again, this is really new, so a lot of them are not even up and running yet, but will be in the coming months and year.
What about the issue of reimbursement rates for providers? Because a lot of this work is done for a population that relies on Medicaid, and so what those Medicaid rates are is critical to the capacity of these providers. Any significant increase in what the organizations that you oversee are going to be receiving for work they do on the Medicaid side of things?
Yeah, definitely for those with co-occurring disorders. As I mentioned, at the top tier, they will have the highest reimbursement rate, and that is ongoing work. So we are working with OASS is working with OMH, and we're working with the Department of Health, right, and Medicaid to really get that exact reimbursement rate. But yes, that is obviously a very critical part of this is to make sure that that reimbursement matches the level of complexity of the care that's provided. And so that is ongoing work, and the rates will be increased for the more complex patients and the programs that provide more complex care.
How do you avoid, though, getting into this cycle where maybe those well organized, well funded providers can qualify for that higher level of certification and thus have access to those higher rates, where then you have those struggling ones who, for whatever reason, can't get that certification and thus are going to be denied those rates, and then just get into this self-fulfilling, cycle that they can't escape?
Yeah, I mean, well, certainly we provide technical assistance, and we're here to support our providers and to help walk them through this process. So, we're happy to do that. I mean, obviously, we want the best care possible for all New Yorkers, for small organizations and large organizations. And we're there to help provide that support. I mean, I think also the one good example of this is we have a leadership institute that we've recently initiated, and it's been really very popular. We've had, I think, about 500 people go through this, and so that's a way to help build the infrastructure and the capacity in organizations, is like helping building leadership skills, right, and people to grow in their careers and to build leaders. And so we have heard from providers about interest in this kind of capacity building. Some of that is like really focused on the workforce, others that is more focused on the programmatic side. And so we are trying to really do that with our providers of all sizes and really across the state.
In terms of supporting providers, are you doing anything to help those that are trying to work with maybe hard to reach populations for whatever reason? Maybe they have historic distrust of government, maybe they just, I don't know, don't want to deal with government. Is there anything that you can do to support those efforts, particularly when it comes to, say, life saving harm reduction services?
Absolutely. I mean, I think this is where a lot of, for example, our opioid settlement funds are going, is exactly in this work, right? Which may not be billable work, right? You may not be able to bill insurance for going out on the street and meeting people and encouraging them to get treatment or to give harm reduction supplies. But we also know that those individuals may be the most risk, at the highest risk for dying or having poor outcomes. And so we are using dollars to support teams and programs to go out into the community, do outreach on the streets, and in various parts of the communities, using vehicles, bringing services to where they are, using mobile units. So a lot of that is not covered by insurance. And so we're using those dollars to really provide that complementary kind of care. That's one thing. And then, of course, for those who are underinsured or uninsured, we that's how we use our state dollars. That's what it's there for, is specifically to be able to provide services to people who do not have insurance. And so, this has been ongoing for years. And just recently, we actually expanded support of that with anticipation of Medicaid cuts by the federal government, right? To really make sure that our system is supported, and so that those providers that are really providing a lot of care to people who are underinsured or uninsured, to really support them. So that is happening, again, in anticipation of a lot of these federal cuts around Medicaid.
Well, we've mentioned the Opioid Settlement Fund Advisory Board a few times now, and for listeners who aren't familiar, this is money that the state has collected as a result of settlements with opioid manufacturers and distributors. And there's been a lot of discussion about the money allocated, and there's been discussion about the money that's been going through the procurement process. Do you have a count as we talk here in late February about the money that has actually been spent through the Opioid Settlement Fund Advisory Board?
Yes, so we have made over $450 million available. That's what's on our website, and that leads the country in terms of any other state, in terms of the dollar amounts that we've made available and the speed in which that's happened. But I think to your point, all of those dollars were not available on day one or year one because we have multi-year contracts, right? This is what the board recommended. This is what programs recommend, because you're not going to start a program and end it in a year like that. What would that do for sustainability and stability? So instead, the contracts are for 3 years, 4 years, 5 years, so that we can make sure that there is sustainability and stability in the system. And so we wouldn't expect that all of those dollars would then be spent in year one or year two or even year three, because again, they're multi-year contracts. So this is, I know people want to know what that dollar amount is specifically. And so we are in the process of working on a report right now that we anticipate will be out soon, that will provide a lot of the details around the exact dollar amount that's spent. And some of that is, to the OASAS program. Some of that is the Department of Health programs. Some of that is to what's called the regional abatement, which means the money goes to the counties or the money goes to the cities. So there are many pieces of this puzzle. And so this report will provide details at all of those levels.
Do you have a sense, maybe in terms of percentage or maybe in terms of a dollar amount, how much has been spent to this point?
Yeah, so I'll save that for when the report comes out, and we'll make sure that you have a copy of that. It'll be public, obviously.
Well, we've been speaking with Dr. Chinazo Cunningham. She's the Commissioner for the State Office of Addiction Services and Supports. Commissioner, thank you so much for making the time. I really appreciate it.
Yeah, thank you, David, for asking me to be on your show.
Thanks for listening to today's edition of the Capitol Press Room. For an insider take on what's happening in state government, check out our Dispatches from Planet Albany show, available wherever you get podcasts or at capitolpressroom.org.
Join us again for Capitol Press Room, a production of WCNY Connected, Syracuse.